overflow incontinence is the subject of this video. Hi, I'm Dr. Shakib from Core Pelvic Floor Therapy in Irvine. Stay tuned. Okay, so overflow incontinence. What is overflow incontinence? Overflow incontinence is when you think you're done peeing and then you get up and then there's still more urine coming out. That's technically what overflow incontinence is. And then what is the cause of it? The cause of overflow incontinence is multiple things. It could be that the nerves that are in charge of this whole action are compromised somehow. It could be that the pelvic floor muscles are not strong enough. It could be that there is a mass that is not allowing the flow to take place. So all of those are causes. But one of the things that is fully being ignored is the positioning of your body, the actual weakness in the surrounding areas in the pelvis, lower back, lower mid back, and your hips. The alignment of your pelvis, which is huge because every day we're having more sedentary lifestyle than ever before, and it's totally being ignored and not even looked at with regards to the pelvic floor dysfunction and incontinence. So what is the solution in those cases is to address to see what your functional movement status is. Is your posture okay? Is your breathing that goes with proper postures okay? We've done a video on the impact of breathing and incontinence in general and pelvic floor dysfunction. We're going to make sure we put it in at the end of this video as well. But what we want to do is we want to make sure that you're assessed properly for any malpositioning or improper movement of your body. There is a link or a video we will put in this, too many videos to include here, but there's a lot to cover here that has to do with developmental movement, the movements of babies and how they strengthen their posture, and that's the key. No isolation of the body parts, trying to address the lower back weakness or the lower ab weakness. You're not in isolation, you're in movement, so we need to strengthen the whole body while highlighting the parts that are weaker. So we're not isolating it, we're just putting it in a position where it has to do the work while the rest of the body does its job supporting its own weight, so to speak. If you're totally confused about what I'm talking about, which probably you are, I suggest you check out the link in my website, which you can find in the description box under the title of developmental movement. So check out my website and you will see what I'm talking about. If you have any questions, contact me using one of the methods of contact, and do know that your problem is solvable a lot more than you realize. You don't have to live with this necessarily. Thanks for watching. Take care.